The advantages of wrapping the incisal edge and interproximal surfaces in porcelain veneer restoration. We're talking about including the interproximal surfaces and the incisal edge when placing porcelain veneers. When veneers first came out, we only prepped halfway through the interproximal contact and didn't include the incisal edge at all. They were just on the facial surface of the teeth, and they were a very good restoration. But what we found was, if somebody drank red wine, coffee, tea, any of those things that stain, you'd get stain in the interproximal area. It was very difficult to seat them because they would swim on the tooth. There wasn't a definitive stop. And as people wore the incisal edge of their teeth and got to the porcelain on the facial, they'd break the incisal edge, or they'd chip the incisal edge. So people started experimenting and doing studies with different type preparations. And it was determined, number one, that a porcelain veneer is a definitive restoration. Once you place it on the tooth, there ain't no going back. You can't just take it off and start all over. So there is going to be tooth preparation. There are no prep porcelain veneer techniques. Don't do that. They look like hell because the teeth are fat. So if you're putting something on the tooth, you need to take something off and go for broke. Just putting something on a tooth, if it doesn't look good and doesn't function well, is not going to make you popular with your patients. So when you place these, do the best thing. And the best thing is to include the interproximal surfaces and the incisal edge. These are the advantages of wrapping. More precise veneer seating, because it just goes chink and seats with those definitive stops. The potential for future interproximal decay is basically eliminated because the interproximal surfaces are covered with porcelain. A more aesthetic restoration, especially with darker teeth, if you don't cover the interproximal, if you only go halfway through the interproximal and a patient has tetracycline stained teeth or darker teeth, that dark tooth can shine through that interproximal area and the patient will not be happy. You eliminate that when you include the interproximal surface. The potential for postoperative interproximal staining is virtually eliminated. There has to be a tiny little bit of composite in the microgap between the veneer and the tooth. It may only be 25 microns if you're using the techniques I'm showing you. If you're not using a very good technique, it may be up to 1,000 microns of micro gap between the porcelain veneer and the tooth. So if that's right between the teeth and the patient's a red wine drinker, coffee drinker, and that composite will stain, and that will not look good and the patient will not be happy. The studies show the restorations are stronger if you wrap the teeth. The provisional restorations are more secure. If you're trying to provisionalize and you've only prepped the facial surface of the teeth, good luck keeping those on the teeth. During veneer seating, the excess filled resin is more accessible to removal because it's all on, or most of it is on, the palatal or the lingual surface. It's not interproximal except for the gingival margin. The form, especially the width of individual restorations, can be idealized. I published an article on restoring mild to moderately crowded teeth with porcelain veneers without orthodontics. And it shows the advantage of interproximal preparation because you can correct the crowding and also you can idealize the teeth. You can make each tooth the proper width if you include the interproximal contact. Even when you include the interproximal and the incisal edge, the preparation remains in enamel 95% of the time. The disadvantages of wrapping the incisal edge and interproximal contacts in porcelain veneer preparation: slightly more tooth structure removal. The tooth doesn't know the difference. It's still as strong as it was before the interproximal surfaces and the incisal edge were prepared. You can't go back anyway. Why not create a situation that you can place the ideal restoration rather than having all those issues by not including the interproximal surface and the incisal edges? Now, these are some articles on wrapping, Journal of Prosthetic Dentistry. Incisal interdental overlap appears to provide the veneer with a superior intrinsic resistance due to better stress distribution in the restoration itself. Monnier and Douglas, International Journal of Prosthodontics. The removal of facial enamel negatively affected stress and strain distribution, whereas the removal of interproximal surfaces did not seriously increase the crown deformation. Newman's. At 5 years, 2 carious lesions were observed. In both cases, they were located at the interproximal margin of the veneer restorations. So if you cover the interproximal surfaces with porcelain, you're basically eliminating any chance of decay. Monnier and Belser, the establishment of interproximal incisal wraparound offers many advantages. It facilitates the aesthetic definition of the veneer in the incisal zone. It enhances the liberty of the dental ceramist with respect to form and emergence profile of the restoration. In other words, if the teeth aren't the correct widths, you can correct that with the veneer if you include the interproximal surfaces, or you break the interproximal surfaces with your preparation. And it facilitates the placement of the final restoration, e.g. stabilization of the veneers and easy access to all margins during bonding. Monnier and Douglas, again, our results is in accordance with previous work on natural teeth, which states that the reduction of proximal or interproximal enamel does not seriously increase the crown deformation. In other words, it doesn't decrease the strength of the natural tooth. It's concluded that the removal of facial and palatal enamel more seriously affects the strength of the teeth than the removal of interproximal enamel. And that's the Dental Minute on wrapping.
Hey guys, I hope you loved this episode of the Dental Minute. Go ahead and press subscribe right there, right now, and get excited because next week we are answering the question you all want to know: how to never get a dry socket. You will not want to miss that conversation. We'll see you next week.